हेलो गाइस, कल यानी कि 20th नवंबर 2023 अटल बिहारी वाजपेयी मेडिकल यूनिवर्सिटी ऑफ लखनऊ के अंडर ये MBBS डिग्री एग्जामिनेशन यानी कि फर्स्ट प्रोफेशनल एग्जामिनेशन था, जिसमें कि ये पेपर 2 है ह्यूमन एनाटमी का। ओके, 100 मार्क्स का पेपर था। 20 मार्क्स के MCQs में डिस्क्राइब कर चुका हूँ। द रिमेनिंग क्वेश्चन पेपर इज ऑफ 80 marks, that is section B, and it is a theory question paper. Let's have a fast review. So there was a long question of 15 marks on the anatomy of kidney. So this is called a structured long question, where you have to describe the anatomy of kidney under the following headings of 5 marks each: gross feature and coverings. So here you have to describe all the shape, size, orientation, position, angulation, everything. Longitudinal axis, transverse axis, and everything. The poles, the surfaces, the curvatures, everything regarding that, even the weight. And then the coverings means the capsular covering, then the perirenal fat, then the paranephric fat, and the renal fascia and its extent or continuation of renal fascia. There are relevant videos on this topic I have already made. I'll attach the link. You can watch it from there. Then the arterial and venous drainage. Here arterial supply doesn't mean simply the renal artery or renal vein. You will have to describe the intra-renal blood circulation, which I have already asked in my pre-university exam. Then anterior and posterior relations of the kidney. This question cannot be explained without the help of diagrams. You should make diagrams wherever they are necessary. This helps you to achieve good marks. Then there was a clinical case scenario based question. A 50-year-old lady visited a doctor for pain and swelling in the upper medial side of her left thigh. Radiological and physical examinations revealed herniation of abdominal viscera below the inguinal ligament in the femoral triangle below and lateral to the pubic tubercle. So you need not have to make a diagnosis here, because they've already mentioned in the first subpart why femoral hernia is common in female, right? So they have mentioned it here. Mention the compartments of femoral sheath and its content. Enumerate the coverings of femoral hernia and mention the course for reduction of it. What care should be taken by the surgeon while widening femoral ring in case of strangulated femoral hernia? Remember, there was this abnormal obturator artery running over the lacunar ligament on the medial side. Write the other swellings found in the femoral hernia. Don't forget about the superficial inguinal lymph nodes, the deep inguinal lymph nodes, or any bony tumor, or the femoral artery aneurysm. So this question on femoral hernia I had already asked in my pre-university exam. Then short note questions. We have to write approximately 500 words. 5 questions, 6 marks each. Thoracoabdominal diaphragm. Not only the openings, remember its peripheral attachment, central tendon, the vertebral level, nerve supply, blood supply, movements, and the hernias. The congenital, the adult hernias, Bocadellix hernia, sliding hernia, rolling hernia, everything you'll have to write here. Ischioanal fossa. This was also very well taught. In each of these questions, there is a lot of clinical and applied anatomy. You can include it. So don't forget to write about ischioanal abscess and the pain arising or the fistula being formed. And you can also compare it with the perianal abscess. Development of pancreas. This has been well explained by me in the previous year's question paper. This is a repeated question from 2021 batch. If you would have watched that video earlier, you could have done it better. Different positions and histology of vermiform appendix. Super important positions and histology of vermiform appendix. This also has been explained in detail by me because it's a repeated question. This has been asked in 2021 main exam, and I had uploaded the video, so you can again revise it from there. So both these questions, pancreas and vermiform appendix, they are repeated question from the previous batch. Then medial longitudinal arch of foot with its applied anatomy. This is a commonly asked question. Pes planus has been asked in your senior batch, 21 batch. That is a clinical applied anatomy of the medial longitudinal arch. You can include it here. and I've described pes planus in the previous year's video. Then short answer questions where you have to write within 100 words. These are 5 questions of 4 marks. Tetralogy of Fallet, the 4 congenital defects you have to mention here. Enumerate the normal constrictions of ureter with its clinical importance. Again, a repeated question from a pre-university exam. What is mesentery? Enumerate the structure crossing the root of mesentery. All about mesentery I have already explained in my dissection videos. Klinefelter syndrome, genotype and phenotype. Klinefelter even I have explained in the previous year's question paper. There was some question on the abnormalities of the chromosomes. There even I have explained about Klinefelter XXY syndrome. Then histological differences between jejunum and ileum with labeled diagrams. See, there are less of differences between jejunum and ileum. There are gross differences as well as microscopic differences. Here they have asked is the histological, means the microscopic differences. So remember jejunum and ileum. If you compare it, the walls of Kirk ring are more densely placed, more in length and height here in the jejunum, and they are less or ill-defined in the ileum. There are more of villi, length of villi and the density of villi is more in jejunum, less in ileum. And what is more in ileum is lymphoid aggregates. The aggregated lymphoid follicles called Pear's patches, which are well defined in ileum. They may or they may not be found in the jejunum. There are mostly solitary lymphoid follicles there in the jejunum. You can also mention about the difference in the arcades, the decreasing lumen from proximal to distal, although they are more of gross features. So that's a short description about this question paper. I will be explaining it in detail sometime later in a longer video. Good luck.